Welcome, good afternoon, and thank you so much, everyone, for joining us at today's webinar, How Caregivers Are Transforming Care Through Music. Hi, everyone. I'm Monica Moretta, and I'm a program manager at McMaster Continuing Education, and I'll be your host this hour. Today, I'm joined by our instructor and guest speaker, Dawn Ellis, from the new MCE Fundamentals of Music Care Theory and Context course. Dawn is a highly skilled professional in this field who brings deep insight into how music care can meaningfully transform care experiences. Together, we'll explore how caregivers are using the power of music to enhance connection, comfort, and communication in care settings, helping both caregivers and those they support experience moments of harmony and healing. McMaster University recognizes and acknowledges that it is located on the traditional territories of the Mississauga and Haudenosaunee nations and within the lands protected by the Dish with One Spoon Wampum Agreement. I would like to introduce our instructor and guest speaker, Dawn Ellis. Dawn is the Director of Programs and Community Partnerships at Music Care by Room 217. Leading initiatives that advance the intentional use of music in care settings across Canada. With a background in performance and community music and previous roles in K-12 arts education and with the Toronto Symphony Orchestra, Dawn brings a deep understanding of music's impact in education and healthcare. She has presented on behalf of Room 217 at multiple national and international conferences, including the World Congress of Music Therapy, the International Association of Music and Medicine, BC Care Providers Conference, and the BC Palliative Care Education Days. And with that, I'd like to hand it over to Dawn, so kindly enjoy the presentation.
Thank you so much, Monica, and it's been a joy to partner with your continuing education team to bring this course, our music care training, into the continuing education stream at McMaster. And today I'm going to be sharing all kinds of examples of everyday music makers, how caregivers are transforming care through music. And so we're going to be talking about some of the projects, the ideas, and the work that caregivers have been doing, bringing music into care. But first, what we're going to do is watch a video called Why Music by Pulse Music Media. And this video, I think, is really critical to start our conversation today. And what it does is it frames music from the standpoint of not just performance, but as a tool and strategies that can be used in care settings. So I want you, however you're joining us today, in your role of whether it be a family caregiver, a social worker, or somebody else that works in the context of caregiving, think about your scope of practice, the work that you do, as we watch the video Why Music, and see if there's something that resonates with you while watching.
Why music? What is it about music? Why does it give us chills? Why does it make us dance? Why does it make us cry?
How does music do it? How does music take us back in time? How does it keep us hopeful for the future? How does music keep us connected?
What's your favorite type of music? What do you listen to when you're sad?
What do you listen to when you're happy? What about when you're angry?
How does music therapy work? Can music really heal us?
How does a symphony work?
What's the greatest song ever written?
Why should I care about classical music?
Is pop music really that simple?
Is classical music really that hard?
What's the difference between major and minor? What is harmony? What is melody?
What is music? How does music connect us?
What's the last song you want to hear before you die?
Have you ever stopped to think?
Why music? Music can change your mood. Music can change your mind.
Music can change your breathing. Music can change your blood pressure.
Music can change your faith. Music can change your beliefs.
Music can change your ideas. Music can change your brain.
Music can break barriers.
Music can tear down walls.
Music can teach us about each other.
Music can tell our stories.
Music can inspire change.
Music can change the world.
Excellent. I hope there were a few moments or a few of the statements that they were making that might have resonated with you as we start to think about how music can be used by caregivers in care. And so that brings us to this slide here, because music can. And if you look, we'll talk about 3 areas that music strategies delivered in care by caregivers can impact quality of life. And that can impact quality of care, and that can actually impact care economically. So when we're looking at this course that we're going to be offering on the continuing education platform, it's all about learning different music care strategies and really unpacking why music and why care and how music can be used in caregiving. So we know from our organization and through research, we know that music can increase engagement, and we're going to be talking and seeing examples of caregivers who have done that. We know that music can actually decrease depression, and we know that involving music in some of the strategies that we will teach caregivers in this course, we know that it really is human, it's relational, and it's actually delivering person-centered care. And we also really are investing, when we're investing in music strategies, we're really providing dignity at end of life. And again, after this slide, we'll start walking through examples of how other music, caregivers have used music in their scope of practice and some of the projects and the outcomes from implementing the strategies that we teach in this course. And so quality of care, I mentioned already that using music and our strategies is offering person-centered care. We know that using music can support diversity, improve the culture of care, but really exciting for us is we also know that there's an economic impact, that using music programming and music strategies can decrease the need for antipsychotics, looking at social isolation and loneliness, and using music to engage and create sense of belonging actually has been proven to decrease hospital room visits and decrease responsive behaviors. So we are really thrilled. This past summer, there was a report released, the Deloitte report, and what it said that specifically using music engagement strategies, for every dollar invested in music engagement strategies in care, the return on investment was actually $2.40 annually. So as an organization, and for those of us that are caregivers that use music in care, specifically in older adult or with dementia communities, that's really exciting news. So again, even in the course, we'll probably refer to that report a few times in the content. And so what exactly is this course about? And this course is about teaching caregivers, whether you're a social worker, whether you're a family caregiver, is teaching caregivers the music care approach. And that is the intentional use of music by anyone to improve health and well-being. It's the intentionality. And so when we learn about strategies and we learn about information and how music can be integrated into care, that's the intentionality. And when we do that, we're actually applying and using the music care approach. And the goal of our course is to integrate music into caring relationships, into care tasks, and care plans. So I just want to show the faces here of some folks that have already gone through this music care training. Again, we have offered it for years as an organization, Room 217, but we're excited now to offer it asynchronously through continuing ed. And this means now that caregivers can take it on their own time, which is becoming, as we know, it's a response our organization is making and dedicating into the needs of caregivers and their schedules. So who are caregivers? And this course is perfectly situated for family caregivers, nursing staff, anybody that works in and around recreation programming, therapy, activationists, PSWs, DSWs, educators, musicians, again, program staff, volunteers, social workers. So we in our course, well, in this course and in the training, that refers to your scope of practice. So your scope of practice is an educator, a social worker, or it could be a family caregiver. And then we're teaching you music care approach and strategies and giving you tools that can help you bring music into care in your scope of practice. And that's a really important distinction. And this is, again, just some highlighted features of the course content. And what we study in the course is sort of how is music delivered in care? And we want to make that distinction. You'll notice there's professionally informed music care, and there's intentional music-rich environment on the right-hand side of the circle here. And then there's knowledge development and translation. And for us, it's really important that we distinguish a difference between the clinical practice of music therapy and then what this course is, which is teaching music care strategies to those that have a scope of practice. So again, music therapy and music medicine, those are clinical approaches using music as an intervention, where in this course is for caregivers, for rec therapists, for volunteers, for those that work in care to use music and music strategies to deliver better quality of care. But again, we're still honoring and recognizing that music therapy is different, and that's a clinical scope of practice. And so let's actually, I'll go through at the end of the presentation what is sort of the 10 strategies, like what those 10 strategies that we teach you at the end as we talk more about the course. But let's look now at some really compelling outcomes. And the next examples I'm going to show you are across different care contexts and different care communities. And they're actually projects that were implemented in care by caregivers. We're showing outcomes of those projects. And what's unique is that each of these examples are actually examples of music care initiatives or action research projects that were started and in the level 1 training, which is the course that we're now offering through McMaster. So again, what you're seeing now are some case studies and some observations of how caregivers have been successfully integrating music into care. So the Alzheimer's Society of Peel looked at the sound environment that they were delivering care in as an organization. And so what they did after receiving training and resources, they looked at the impact of the sound environment that caregivers were delivering programming in. And by making changes and coming together as a care staff and team, what they did is over 6 weeks of implementing these strategies, they were able to reduce client wandering by 40% in their adult day program. And that was really quite significant because if you can address the wandering or those expressive behaviors that happen in care through music strategies, then that actually decreases staff stress. Because by using strategies in the delivery of your programming, you're able to actually focus on the delivery of programming because you're mitigating those expressive and responsive behaviors. And so that by decreasing staff stress, that's a significant impact. So creating the sound goal, through using music care strategies to improve the sound and create sound goals together, you decrease client wandering, which allows staff to then implement and focus on programming. And that also increased client engagement by 75%. So again, what you're seeing is evidence of music care strategies that began in the level 1 course, and you're seeing them implemented by care teams. And so in a different context, that was adult day programming, we're going to now move to work that caregivers have used music care strategies in hospices. And so now we're going to look at the effects of live music visits with residents. And so over 6 weeks, nurses in a hospice were observed the impact of music visits on residents And they measured different things biologically. They looked at the response of folks, and their mood after music visits. And the results were really quite compelling. And what was exciting about this study is that caregivers helped design these programs, worked with residents, and then it was both clinical nursing staff and the musicians that came in that actually noted the feedback on residents. And so over 6 weeks, we learned that 83% of residents felt more calm, 67% of residents felt more comforted, and 100% of residents felt happier after music care visits were organized. And again, at the end, I'll talk a little bit more in depth, but we really want to acknowledge that anyone can use these strategies. So that was organization of live visits, but our course actually teaches 10 specific strategies that caregivers can deliver in care, and it's really for anyone. You don't have to be musically talented or have a vast music experience to be able to use music care strategies. And that's the purpose of our course. Our course really is to be inclusive of anyone that works in care and give anyone tools and strategies where caregivers can implement music in what they're doing. And so we're going to look specifically at what a care team of recreation staff, how they used music after COVID to try to bring male residents specifically back into programming and engaging with male residents. At this location or organization, they noticed a challenge or a lack of engagement specifically with some of their male residents. And so they used music conversations, music programming delivered by rec staff to try to bring or create programming that was specific to male residents. And the observations again were extremely positive. They noticed through the music care programming through the rec staff, again after learning strategies and implementing programming, they noticed improved mood, and then they noticed again a greater sense of belonging and engagement, and also that it increased cognitive stimulation. And that's really exciting because we know a sense of belonging is really important, especially with older adult communities. And I think what was exciting about this work is the care staff noticed that the conversations were continuing from the program into actual other like dining spaces, dining conversations, that just using music conversation strategies, which are part of this course, actually help to increase engagement in the long-term care residence in itself. And so now we're going to look, because actually this program, the music care training course, can actually be, those strategies can apply to any care community. So these strategies we teach, again, they're to be used in your scope of practice, whether you work with youth, whether you work with older adults, or any age group in between. And so this was a school that looked at the educators were taught some of these music care strategies and implemented them with their students. And they noticed that using creative visualizations and other wellness strategies before assessments actually created just a more positive and relaxed environment going into those assessments. So it created a space and trained the space for better focus for students. And also humming and singing a grounding song helped mitigate self-regulation challenges and resulted in fewer interruptions during class lessons. So again, a school using some of those strategies that were used to in the older adult communities to mitigate expressive or responsive behaviors in a school context can actually be used for self-regulation and focus before assessment or a challenging lesson per se. And so I'm now going to look at a series of you could say outcomes from music care training that were looked at within a Kindera Living, which is a long-term care you could say, a management group of 9 long-term care homes. And these are all action research projects where they took the training a little bit further, and they measured it across 6 of their spaces. And what I love about the music care training is, again, you have as a caregiver a scope of practice. We teach 10 strategies, and how you apply those strategies is customizable to a challenge that you might have in care. And so at Dundurn, they actually invested in looking into resident preferred music. And they also, by adding resident preferred music, collecting that information, which is very person-centered, what they did is they reduced expressive behaviors by 78% within their care space. Banwell Gardens looked more at the emotional domain of music, helping process grief as a care team. And so what the staff realized, the caregivers realized at Banwell, is that some of the staff were having trouble processing grief if a resident had passed away. And so they created a program, a music care strategy, looking at sharing meaningful songs is the name of the strategy. And by creating songs to honor the residents together as a staff, it helped the team members, the caregivers, actually process grief better and together as a team. So that was pretty exciting, and also is a great community way to represent and honor residents within a care space by caregivers. Again, Hawthorne, their challenge was more looking at the impact of music on sleep quality. And so at Hawthorne, what they did is they looked at, can we help improve sleep quality through preferred music and sleep time with their residents? And after implementing a music care strategy and preferred playlists or sleep playlists, they increased sleep time by 20% and sleep quality by 33%. And so, again, another challenge that can often be come forward within care settings can be eating or dining appetite. And so at Anson Place, by using personalized playlists, they actually were able to increase the appetite of residents by 19%. And again, resident engagement was used and increased by 18% through one-on-one music care visits. So at Arbor Creek, they used music conversations, which is a strategy, to help increase engagement. And that's significant because if you're using music conversation and strategies like that, which is part of our training, then what you're doing is really deepening those relationships, and you're using music as a way to connect to somebody, and that can tap into their personal interests and even beyond that, their upbringing, their culture, their cultural connections to life. And so it's a great way to be able to learn more about residents as you're intaking new residents, for example, or if you're working in the capacity as a volunteer. And then at Eatonville, they looked specifically at using a Music Care Connect app, which has music all created at 60 beats per minute, to increase appetite by 50%. So by implementing instrumental music in dining, that's a very predictable tempo that helps to entrain a space with a specific mood, again, they were very successfully able to increase appetite by 50%. And so just unpacking a little bit more about the course, we're looking at, what are these strategies that I've been talking about? So in this course, which is a level 1 music care training, again, we uncover why music, why care. We look at a caring community. We help locate our own scope of practice. And then we end the course with learning 10 strategies that caregivers can use right away, regardless of the work that you're doing. And so these are evidence-informed strategies, and they've been developed and implemented over time. We're now offering this course here through Continuing Ed, but I will say that we've been offering this training as an organization for many, many years and have trained thousands of caregivers across the country in these strategies. So at the end of this course, if you take it, you're really building your toolbox as a caregiver. And so these are the 10 sort of strategies that we unpack in the course are breathing intentionally. That's coming alongside somebody. If somebody is anxious, using and discovering how breathing intentionally can help you become more present and in the moment. And again, that really rolls into humming as presence. And we teach the value of humming and what it does, to us parasympathetically. And then we go through singing one song, and how residents, or if you're working in care, how you can use the power of one song to help connect and deepen relationships. And then how writing simple songs can be used, let's say, as a tool to help discern an order of a task. And actually, educators, especially educators in youth context, do this all the time. It can be writing simple songs can be a great way to implement a strategy or an order of doing something. Picking songs for care context depending on the need that you have in care. Sharing a meaningful song is a great strategy. Designing a personal music care plan is a great way to also connect with caregivers on how they can help in their own self-care. This course also unpacks a little bit of music wellness and music care strategies to help caregivers deal with compassion fatigue, caregiver burnout, moral injury. There are these sorts of topics that we sort of touch upon in the actual curriculum. Assembling a music care kit, looking at different resources that can help support programming, and building a playlist and a music care program. Playlists can be used. I mentioned many of the strategies above were all around creating a person-centered care playlist and more. But really, number 10, the 10th strategy, is what you are seeing in action. That's a music care initiative. What you start doing after you walk through the curriculum and the content of why music, why care, and the 10 strategies, is you start looking at your own learning where you are with using music and how you can implement music in something that you're doing. So we start to unpack a music care initiative that you then work through in the course that you might be able to implement in the work that you do. So again, those are the 10 strategies that take up half of the content of the course. And really, that lends us to sort of provide an overview of the fundamentals of music care theory and context of this course, which we are launching in January for the first time through the continuing ed program at McMaster.
Wonderful. Thank you so much for that, Dawn. Well, I wanted to thank Dawn again. Thank you so much for an incredible webinar, spending time with us today and imparting your wisdom and introducing our new course. Thanks again to everyone for joining us today. I really appreciate it for you taking time at your lunch hour to spend time with Dawn and I. So thank you everyone once again for joining us today. And I'm wishing you a wonderful afternoon and a great rest of your week. Bye-bye now.